Mr President, I rise today in support of the honourable member's motion in acknowledging Daffodil Day and the important work that the Cancer Council does in its ongoing commitment to raising funds for cancer research, increasing cancer awareness and providing support for Australians diagnosed with cancer and their families. It is estimated that 151,000 Australians were diagnosed with cancer in 2021. That's over 400 people per day. That's 400 families who are touched by this insidious disease each and every day. Every year, approximately 3,800 South Australians lose their life to cancer. That's 3,800 families who lose a mum, a dad, a sister, a friend, a grandparent, a child. Mr President, sadly we've all been touched by cancer in one way or another. Maybe it was a grandparent, maybe a parent, maybe a friend, maybe even yourself. It's estimated that over 1 million Australians are currently living with cancer or beyond cancer. The number of new Australian cancer cases diagnosed over the period from 2020 to 2044 is projected to total more than 4.56 million. Around 70% of people will likely survive 5 years after a cancer diagnosis. This is an increase from 51% since the late 1980s. The number of Australians living with or beyond cancer is expected to increase by a staggering 72% in the next 22 years. By 2040, 1.9 million Australians will be living with or beyond cancer. Mr President, if there's one thing that we know for sure, it's that cancer does not discriminate. The most common cancers for South Australian females in 2020 were breast cancer, colorectal cancer and lung cancer. Lung cancer was the most commonly reported cancer cause of death for females in South Australia, accounting for 17.4% of cancer deaths, followed by breast cancer. For South Australian males, the most commonly diagnosed cancers in 2020 were prostate cancer, colorectal cancer and lung cancer. The most commonly reported cancer causes of death in South Australian males were lung cancer, accounting for 20% of all male cancer deaths, followed by prostate cancer. Mr President, these are incredibly sobering statistics that serve as a good reminder to us all to go get that health checkup that we've probably been putting off. My family is not immune from cancer and have had multiple family members who are either in remission or have sadly lost their battle with cancer. One of those people is my mum's mum, Barbara. Whilst I sadly never had the opportunity to meet my grandmother, as she lost her battle with acute myeloid leukemia at the young age of 45, she lives on in my mum. Last month, my mum and I had a fundraiser for the Leukemia Foundation in honour of Barbara, where we were able to fundraise over $1,000 and donated our hair to sustainable salons who are part of the Ponytail project run by the Cancer Council. This organisation distributes them to charities and local wig makers where they can become wigs for people going through medically induced hair loss conditions such as alopecia and cancer, or help fund other life-changing programs. I'd like to take a moment to thank the many people who have donated generously for that generosity for this very important cause. I'm sure that we've all got similar stories about the devastation and heartbreak of cancer, and I, for one, am very glad that charities like the Cancer Council exist to provide ongoing support for patients, their families and ongoing medical research. Thank you for those who have taken the time to support Daffodil Day and for those who continue to support charities like the Cancer Council. I'd like to take a moment to acknowledge the honourable member once again for his contribution and for bringing this motion to this place, but also for his honesty in sharing his own personal circumstances with this place. Thank you.